I now want to welcome the co-chair for this session, Chiara Poletto, a researcher from Institut Pierre, Epidemiology et de Santé Publique in France. Chiara, please join us to go through the next part of this session, which is discussions.
Thank you so much, Dr. Mariano. So, good morning, good afternoon, good evening to everybody. So, thank you so much. I'm happy to be here, and I would like to thank you, the speaker, for this insightful session. It was really great to see all these things together. A very nice perspective of this challenging topic.
Thank you, Chiara. Let's go for the questions to the panelists that came from the audience. So I'll take the first question addressed to Dr. Balkhy. The question is it expected to have another peak for COVID-19? And there's a second question to that is why there is no unified global system for epidemiology to facilitate access to information, address infectious disease, and take actions easily. So it's basically, it's two questions. One, do we have another peak? And why there's no global system for epidemiology? Dr. Balkhy, the question
Thank you, Bernardo, and thank you very much. Can you hear me? Yes?
Yes.
Okay, thank you very much. Welcome, Chiara, again to the platform. Thank you very much for the audience, the person who asked this very critical question. We've been asked that over and over again. A second peak, I think we need to, this is the first time we've been facing such a situation over the past 100 years. And I think a pandemic that's lasting and continues to evolve over the next months that we see, each country will be looking at their own epidemic curve, and a second or third or fourth peak, whether hopefully not as high as any country's first peak, is probably something we're going to see in many countries. I hope not all countries. And the reason behind that is the platform for developing a vaccine for the coronaviruses does not exist the way it does for influenza. So in 2009, when we saw the H1N1, it was very imminent that the vaccine was going to be available. The impact that this virus has on economy pushes us and forces us that we need to figure out ways to open up our systems, our education, our trade, our economies, to be able to survive and to save lives and livelihoods. And while doing that, we will see smaller outbreaks in the different countries. However, I think it's critically important that we be patient with this pandemic and that we understand that we are all on an extremely steep learning curve with this specific virus. I'm happy to answer any variations from that question, but that's the short answer to it. With regards to why is there not a, or will there be a specific platform to share data and for us to be able to manage this in a more, in a faster way, in a more efficient way? I think I want to refer the audience back to the international health regulations, which was a mandate agreed upon by the 194 member state countries. And where I was part of a review committee for Ebola 2014, it was very clear that many countries have a bit of a conflicting interests, because in one perspective, we want to secure our borders, we want to ensure that we are not exposed to emerging pathogens, but at the same time, countries find it difficult to announce and be super transparent with what is evolving and what is happening in a public health perspective on the ground. And I think one way for us to be able to create such a platform that is accurate, efficient, and provides accurate data is for us to understand that the public health issues around emerging pathogens are not unique to any one specific country or to any specific culture or behavior. And if we are not honest to be able to study and understand what are the reasons for this happening, we won't be transparent enough to address these situations. So again, I think we need national unity, we need global solidarity, and we need to be able to adopt the international health regulations, which actually allows for better data sharing and intervention implementation around the world, for us to be able to manage this as truly one community. Over to you, Bernardo. Thank you.
Thank you, Dr. Balkhy. Chiara, you might want to maybe make some observation or perhaps even take some of the questions from the audience. The floor is yours.
Yeah, I saw a couple of questions that are quite interesting. And so for Dr. AlHazme, did you think about the data validity that you got from the people? That's quite a specific question. But always about data, maybe on a completely different level for Dr. Balkhy, how WHO verify the data that are gathered? So how verify that the number of infected cases collected worldwide are accurate? So I think these are like two faces of the same coin.
Yeah, that's a very important question, and it has been going on in the data science realm for years now. It's not really specific to digital epidemiology, but it's highly relevant to digital epidemiology, especially nowadays. When we are calling for data sharing between regions, countries across the globe. There's no way to standardize data. There's no way to control the quality of data from the beginning. So you have to deal with the quality of data after the fact, after you receive the data and you put it in a reservoir, maybe a data lake. In the data science realm, when it comes to data quality, there were two schools of thought in the beginning. So one school of thought, and that was the first one, was about starting with a high quality data, then analyzing it and make informed decisions based on the high quality data. So do not do anything, do not analyze, do not start acting until you get top quality data, and then you start. This turned out to be highly challenging, even within the same organization. It became next to impossible because what they call a phenomenon known in the big data realm, which is the data explosion that has been happening over the last 20 years, where the generation of data has been increasing significantly. So the other school of thought said, you know what, let's not do this. There's no way to start with high quality data. So you start with whatever data you have, you start analyzing it, and then you will identify the issues, eliminate the issues, and then go back and analyze. Then eliminate the issue, go through the cycle until you end up with a data that is workable. And that's the theory of data lake.
Thank you, Dr. Raed. On the question about the WHO, how to verify data regarding number of infected cases worldwide, whether it's accurate or not, as you know, WHO has member states, and the member states are providing all the data to WHO, and there's a whole network that started from the time of influenza to collect data from the countries to then create the global picture of a pandemic. So that network exists since the period of the influenza, and it's been used currently. And so basically, the data that WHO produce on the current pandemic is the data that country deliver to WHO. If the question is whether, the question says whether how reliable it is as reliable as member states, countries provide to WHO. So that's so we work in an ecosystem of trust where we trust the member states that are providing the data that is reliable because it's for public global good. public health and global health, and therefore the teams that work with the member states, our emergency teams do work with the member states to provide that current data. But you might have seen that also there are other data sources from universities that do complement data from member states. And actually, sometimes there is a difference between Johns Hopkins data, for instance, and WHO data. Johns Hopkins has also its own network of data collectors from member state that collects from each country, look at all the social media, and then they collect data. So the data from WHO is verified by the member states and is our official statistics and data from member states. And if there's any issue, we normally contact the member state to discuss, if you see the correction or address any issue that comes with data that is provided. Dr. Balkhy, you might want to complement Dr. Raed's comments on the data side.
Right. Again, just to re-emphasize the issue of the data sharing from the member states to WHO, going through the regional offices. So the WHO has 6 regional offices, and it has over 100 or almost 180 country offices. And each country is mandated or has, one way or another, the International Health Regulation focal point. That focal point is responsible for reporting to the WHO through the proper channels on through specific guidance and guidelines. Some of the pathogens need to be reported within 24 hours, some within a week, and some on a regular basis. So the IHR focal points are the ones who need to verify, and they're nationals, so they belong or they report to their governments. They're not WHO staff. And I think when we talk about the issues that my colleagues have just mentioned, it is the willingness to share this data, but it's also what we need to emphasize in this specific summit is there needs to be a huge emphasis on strengthening public health infrastructure. Because if we continue to talk about data, we need to understand that data needs to come from a specific source. So if we do not have the trained people, if the countries and the member states are not investing in enhancing public health infrastructure, surveillance program, public health specialists, we will never be able to get the quality of data. And digital data, as most of us would probably agree, is complementary to a public health system that needs to be strong, viable, and supported. So I'll stop here, Bernardo. Thank you.
Thank you, Dr. Balkhy. There is a follow-up question for Dr. Balkhy. It reads, I just want to ask, in your own perspective, how ready are we, the world and healthcare, in regarding the adaptation of effective digital epidemiology? And then that's for you, Dr. Balkhy. And then Chiara will ask perhaps the last 2 questions to Dr. Riyadh. So, Dr. Balkhy, you have.
Thank you very much. Thank you very much. So again, I think maybe I preempted my answer already, but I think how prepared is the world to adopt digital tools? That's the question, Bernardo, correct?
Yeah.
Yes. So I think what is the COVID pandemic, in my humble opinion, has pushed us towards a more expedited need and desire to adopt specific tools. Again, I think in understanding that the global impact of COVID surpassed multiple times the economic crisis that happened in 2008, 2009. And I think it's the economical impact of this outbreak that has really pushed us to try to enhance and support members and government, member states, and governments themselves, again, need to adjust their public health infrastructure, empower it, and be able to really look into the challenges that have already been published in the literature about the challenges for applying digital health and for it to survive. So initiating it is one thing, but allowing for digital health tools to survive and progress within a specific country they really need to ensure that they're adopting the ethical and legal considerations that will allow for this specific technology to thrive and survive over the next years. When we talk about the legal issues and the ethical, the propriety, the autonomy, the transparency, the accuracy of these data, and the personal autonomy and privacy, these are things that may be major obstacles in the progress. So I think there's a lot of hope that digital epidemiology will be able to fill in the gaps of traditional epidemiology, but without addressing the legal and ethical issues, without creating a strong public health platform, they will not be able to prosper. Over to you, Bernardo.
Thank you, Dr. Balkhy. Chiara?
Yeah, so I would like to ask two questions to Dr. Raed. The first one is, are there any evidence correlate the pandemic with the geographic location? So that's the first question. The second one is, how can we use social health code in tracing, improvement and treatment of diseases in Arabia social community?
Well, it's based on some of the simulation modeling. I mean, again, it's an early stage to get some results of studies about contact tracing, because we're still in the middle of the pandemic, where this technology has been established, and it will take some time until researchers start aggregating data about the outcomes of the contact tracing, and then identify the best method of how do you do it, and secondly, how effective each and every method based on the situation that we are dealing with. But as per the Ferretti study that they have conducted, that I presented, which was based on a simulation model. Again, simulation modeling is not highly accurate, but it could actually help a lot when it comes to knowing about the outcomes of certain kind of actions. So you really want to do it in a safe way by doing it in a digital kind of environment. Then you apply it on the ground. What was the second question, Chiara? Or the first question?
So, the first one, are there any evidence correlate the pandemic with the geographic location, that correlate maybe the pandemic with the geographic location?
Well, I mean, the geographical information system has been around for some time now. Surprisingly, again, many think and believe that the precursor and the prequel of what we have now has been developed and initiated by an epidemiologist. And it has come a long way now. Nowadays, there are technologies of GIS, Geographical Information Systems, that allow you to plug AI into GIS analysis. So not only you are visualizing the data that you have, and then you would need to interpret the data and try to find some sort of patterns and issues. AI could be put on top of the GIS and identify issues for you in a semi-automatic way, or maybe automatic way at some point in the future. So GIS has been evolving a lot, and the realm of epidemiology is one of the fields that GIS could help a lot, actually, predicting issues, and also during situations, assist in making informed decisions.
Thank you, Dr. Raed. Thank you, Dr. Balkhy, co-chair Chiara Poletto. We are now ending this session. I want to thank all of you that participants and and then I think the question now is, how can we use the leadership of Saudi Arabia with the G20 presidency to take this very important issue to the next level? Chiara, you might want to just put some comments around that before we close and wrap up the session.
Yeah, thank you so much. And yes, so it was really interesting to see these two talks, because they put one after the other important facts about the acceleration, the huge acceleration of digital health, digital epidemiology, and digital surveillance, and about the fact that in this context, actually this pandemic occurred, so this is even more prompting actually in quite an abrupt way an acceleration. I think that clearly the world won't be the same after, and also the way approaching pandemics, preparedness and reaction to pandemics won't be the same. So thank you so much to the speaker, to the chair, Dr. Mariano, and to all the public that addressed this interesting question for this very interesting discussion.
Thank you very much. And once again, Kingdom of Saudi Arabia, thank you for taking digital health and digital epidemiology to the stage, and then also look forward to work together with all the panelists, but all the stakeholders to drive this transformation, to bring better health outcomes to everyone, including those ones that are not necessarily connected to internet, which is part of almost half of the world that needs still connection to the internet. So let's not forget those ones too. So thank you, everyone. Thank you very much, and it's been a pleasure to have heard from the panelists, but also from having heard the questions from the participants. And I hope this was very interesting for all. But this is not the end, this is the beginning. So let's make this beginning a beginning that will last long and deliver those very positive health outcomes to all of us as we fight the pandemic, including the COVID-19 pandemic. Thank you.